We are told that Ebola is highly dangerous and highly contagious, but how much of that is truth? Local and global media prey on such events and will do all in its power to exaggerate the truth beyond any speculation of reality. So with the media as our main source of information, what are we to believe? Many fellow Americans are in a state of shock, often believing that the Ebola virus will transmit itself through the air and infect them, only to die an excruciating death shortly thereafter. Surely, if this was true, the inhabitants of Liberia would have been extinct back in December 2013, when the first case was made public. So what really is Ebola? Before venturing out to your medical supply store to stock up on hazmat suits, N95s, and chlorine, first consider what the virus is and the truth behind transmission. So the Ebola virus is believed to live in fruit bats and chimpanzees. The main source of transmission is eating foods contaminated with bat or chimpanzee bodily fluids. So these include fecal matter, saliva, and or urine. Some African inhabitants consume bat meat and bush meat. This also increases the risk of post-transmission. The virus is said to attack immune cells, our body's first line of defense. So fever is often the first symptom. Our metabolic rate increases due to our system working overtime to fight the invading pathogens. As the virus progresses, it begins to attack our red blood cells. Hemorrhaging and low oxygen and poor circulation is a result. Ebola is said to attack the liver quickly, so stomach pain, vomiting, and diarrhea are often a side effect. In addition, people have reported reddening of the eyes and difficulty breathing and swallowing. The following compilation is from many media outlets and what they're trying to tell us about the Ebola virus. So they say that once in contact with the virus, symptoms tend to occur 7 to 9 days after the transmission. General symptoms include headaches, fever, fatigue, and general muscle soreness. Day 10 is when fevers tend to spike, vomiting and hemorrhaging occurs. Day 11 often consists of bruising, brain damage, and bleeding from orifices, followed by day 12 when the patient becomes delirious with loss of consciousness, seizures, excessive bleeding, and death to follow. What the media does not tell you is that Ebola does not kill everyone who contracts the virus. Currently, and as of October 15th of this year, 2014, there are 4,000 reported cases of Ebola in Liberia, and out of that 4,000, 2,300 have passed away. It is important to note that this figure is taken from a third world country, a place where medical procedures, sanitation, and funding are much different than our home country. Some say those who contract Ebola have a 50% fertility rate. Others peg this to conservative and place their fertility rate at about 60%. Furthermore, Ebola is not contagious until one begins to experience symptoms. Liberia is ground zero for Ebola. So where did Ebola come from? Ebola was first introduced in 1976 in Africa. The most recent outbreak is said to have traced back to a 2-year-old boy who passed away on December 6, 2013 in a small village in Guinea. The toddler most likely contracted Ebola from either eating foods that had been in contact with an infected bat or chimpanzee or eating infected bushmeat. A week after, the boy's grandmother, mother, and sister also passed away as a result of the Ebola virus. 2 people who attended the grandmother's funeral became infected and then took the virus home to their 2 villages. In Africa, it is customary to cleanse, touch, and kiss the body after death. Since Ebola is most contagious at the time of death, when symptoms are at their worst, it is easily contracted during these rituals. In late March, Ebola reached Liberia, and in June it reached Monrovia, which is Liberia's capital. On September 22nd, Ebola cases had doubled, 3,458 reported cases. Stopping the spread of Ebola in Liberia and surrounding countries is a steady uphill battle. The head of state of Africa, Johnson Sirleaf, ordered a 3-day complete lockdown of a highly infected slum in the capital. An angry crowd fought back and freed all the infected patients from an Ebola treatment center. Liberia is unorganized and chaotic, to say the least. Ambulances are working around the clock to transport the sick to nearby hospitals and treatment centers. Many people don't receive medical treatment due to lack of beds and medical resources. These people can be seen waiting at the hospital entrances, many of which too weak to sit and are forced to lie on the hospital grounds. Some of the ill are transported back home. They then try to fight the disease in their homes, surrounded by family, at a time most susceptible to transmission. So how did Ebola get to North America? It is believed that the first case of Ebola to hit U.S. soil was none other than a man named Mr. Duncan. Mr. Duncan was taking care of Ebola-stricken citizens in Africa prior to boarding a European flight and making a few stopovers before landing in Dallas, Texas. September 20th, 2014. It was reported that Mr. Duncan lied to custom officials when asked if he had came into contact with anyone showing symptoms or having the Ebola virus. 4 days after arriving in the U.S., he became ill and was taken to a nearby hospital. It is said that Mr. Duncan told healthcare officials that he had came in contact with the Ebola virus. However, he was sent home shortly after and was told that he had a low-grade virus. 2 days after, Mr. Duncan returned to the hospital again, this time by an ambulance. This time he was put in isolation in the ICU in critical condition. Duncan tested positive for Ebola on September 30th and passed away on October 8th. According to the Government of Canada, as of October 16, 2014, there are no confirmed cases of Ebola in Canada. The World Health Organization says that they expect the Ebola virus to be under control by 2015, with a total death rate at 10,000. The U.S. is implementing new screening procedures for those traveling to and from Africa, and Canada assures its people that they are well prepared should an outbreak occur. So who is helping Africa? The U.S. military is taking the lead. Obama ordered 3,000 American troops to West Africa to build 17 100-bed treatment centers and a site capable of training 500 healthcare professionals per week. The Bill and Melinda Gates Foundation has donated $60 million, and Paul Allen, who is the co-founder of Microsoft, has donated nearly $12 million. There is no need to live in fear of the virus. Ebola is not airborne, and you cannot catch it by occupying the same space as someone who has the virus. There has to be an exchange of bodily fluids. Next time the media tries to trick you into thinking there is an Ebola epidemic and we're all going to die, do us all a favor and laugh it off and continue on with your day. Better yet, donate to West Africa, the ones that should be afraid.